Hi there everyone, it's Dr. Constance Wong here with my weekly video. So June and July is the time for the big family brush up. So it's a campaign where dentists are challenging families to really focus on their brushing habits. And I know it can be quite difficult getting children to brush their teeth properly. I don't have children, but I do have a 2-year-old and a 4-year-old cousin who I've looked after, and I completely understand the problems that parents face when trying to get their children to brush their teeth. So I've got 5 tips to help with family brushing. So number 1 is to brush children's teeth as soon as they come through in the mouth. So the first baby teeth tend to erupt into the mouth at the age of 6 months. So all you need to do is just get a toothbrush, put a tiny little smear of toothpaste on it and just get the toothbrush in there. That will just get the child accustomed to having something in their mouth and get them used to the minty toothpaste too. So number 2 is to try and incorporate toothbrushing into a routine. So always getting children to brush their teeth at the same time. So first thing when they wake up and once before they go to bed as well. And try and get all the brothers and sisters and mum and dad all involved at the same time too. So it feels like a family affair, the toothbrushing. It's a big brush up, so that's the whole concept behind the campaign. Also make it a fun and happy time, so get children to have different coloured toothbrushes. The brother has one, sister has another, and get mum and dad to have different coloured toothbrushes. Also get them to have different holders as well in the bathroom. And you can also download brushing charts too. So this is off the Denplan website, and it's just basically getting patients to brush morning and night time and every day of the week, so children can really see their toothbrushing progress. So that's the second point. Number 3, I get 3 numbers, 3 fingers. So parents should always brush children's teeth until the child has enough manual dexterity to do it themselves. So a good way to check this is by getting a blank sheet of paper and getting the patient to write their name and address on that white sheet of paper. So if they don't know their name and address, or if they can't actually write it in a straight line, or they can't get the letters right, then they're not capable of brushing themselves. So if that is the case, by all means, let the child brush their teeth, but make sure that the parent goes in and gives everything a good clean afterwards as well. So tip number 4, if you have problems with a child moving their head and you can't quite get the toothbrush in because they keep moving, try and get them to sit on the toilet and get them to rest their head back on the back of the toilet, or get them to stand up against the wall with their head supported somewhere, or sitting up against the bathtub. If they've got their head still, it's much easier to get the toothbrush in and get them to all the right places too. Another way is that you can actually get a child to lie down on a sofa or bed, and actually you can see get in with the toothbrush a lot better. But obviously we want to try and associate toothbrushing in the bathroom as opposed to in the living room or a bedroom. And last tip number 5 is to get children to see a dentist and have them checked as soon as the teeth come through. So obviously that does seem quite early from the age of 6 months onwards, but it's definitely worthwhile getting their teeth checked sooner rather than later. I work in a private practice, but it is free for children to have checkups and dental treatment. It's free under the NHS. So by having regular visits to the dentist, problems can be identified sooner, children can get used to dentistry, and therefore they're less likely to develop any phobias in the future. So just to recap on all the tips. So number 1, brush the teeth as soon as they come through. Number 2, incorporate toothbrushing into a family routine. Number 3, parents brush the teeth for the children until they have enough manual dexterity. Number 4, getting the child to support their head against something like the toilet or a bathtub so the parent can get in a lot easier. And 5, getting the child to see a dentist as soon as possible and getting them having regular checkups too. So that was my 5 top tips for family brushing. I hope you found that useful. Please share the video if you think other people find that information useful too, and feel free to leave any comments as well. And if you want to see any more of my videos, make sure you like my Facebook pages, Dr. Constance Wong and Andre Hedger Excellence in Dentistry. So I hope you all have a great day, and I'll see you same time next week for another handy dental video. So take care. Bye now.